In a world where likes, comments, and shares dictate attention, social media has become a double-edged sword. While it connects us, it also raises serious questions about our mental health. Is our online life harming our well-being? The social media boom visuals, clips of Facebook's launch, Instagram influencers, TikTok trends. In the last 2 decades, social media has revolutionized communication. Platforms like Facebook, Instagram, and TikTok have connected billions of people worldwide. But with this connectivity comes an often overlooked cost. Expert interview sociologist. Social media was designed to bring people closer, but it's increasingly clear that it can also create a sense of isolation, anxiety, and even depression. Globally, users spend an average of 2.5 hours daily on these platforms, sharing snippets of their lives, consuming curated content, and seeking validation through digital interactions. The dark side of connectivity, for many, social media has become a stage for comparison. Highlight reels of vacations, achievements, and perfect lives create an illusion of happiness that can leave others feeling inadequate. Psychologist interview. This phenomenon, called social comparison, is one of the key contributors to social media-induced anxiety. Users often forget that they're comparing their reality to someone else's highlight reel. The constant notifications and the need to stay connected can also lead to FOMO, the fear of missing out, a psychological trigger that keeps users hooked. Statistical graphic. 70% of people report feeling worse about their lives after using social media for extended periods. Mental health consequences. Studies have linked excessive social media use to increased rates of anxiety, depression, and loneliness. For teenagers and young adults, the effects can be even more severe. I used to think everyone had their life figured out except me. Seeing all these perfect posts made me feel like I was falling behind. Psychologist interview. One alarming trend is the rise in cyberbullying. Victims often feel they can't escape the harassment, which can have devastating consequences. In extreme cases, the pressure to maintain a perfect online persona can lead to mental health crises and even self-harm. The role of algorithms. Adding to the issue are algorithms designed to maximize engagement. These systems prioritize sensational and emotionally charged content, often creating echo chambers and amplifying negative emotions. Tech expert interview. Platforms are engineered to keep users scrolling. The more time you spend, the more ads you see, and the more money they make. Unfortunately, this business model doesn't always prioritize mental health. Solutions and hope. Despite these challenges, there are steps individuals and companies can take to mitigate the effects of social media on mental health. Psychologist interview. Setting boundaries, like screen-free times, and following accounts that inspire rather than harm can make a big difference. Tech expert interview. We're seeing platforms introduce features like screen time monitoring and content moderation to promote healthier habits. Visuals of a user turning on, do not disturb, and limiting app usage. Awareness and education are key. By understanding the impact of social media, users can take back control and prioritize their well-being. Social media isn't inherently good or bad, it's a tool. The choice lies in how we use it. By striving for balance, we can stay connected without losing sight of what truly matters: our mental health.